my name is Sarah Seacon. I'm a PA student and I'll be part of your healthcare team today. How are you?
Good, how are you?
Good. I just want to confirm your first name, your last name, and your date of birth.
My name is Mahima Sonda and my birthday is August 18, 2001.
Okay, perfect. I'm just going to wash my hands.
Okay.
Patient is awake, alert, and oriented ×3. Patient appears to be in no apparent distress. Patient is well nourished and well developed. Patient has normal motor activity and posture. Patient appears to be their stated age, and patient has no foul bad breath or body odor. Okay, and now I'll just be inspecting your anterior and posterior chest. So I see no traumas, no lesions on the anterior chest. On the posterior chest, no traumas, no lesions. Respiratory motion is intact and no signs of respiratory distress. Okay, now I'm just going to be palpating your anterior chest. That's okay? Mm-hmm. Okay. And any tenderness? No. No. Any tenderness? No. No. Any tenderness? No. No. Okay. I'll just be checking for tactile effeminence on your anterior chest with just a different hand movement. Okay. So if you can just say 99, 99, 99, 99. Okay. Okay, now I'll just be palpating your back.
Okay.
So just let me know if there's any tenderness when I tell you to.
Okay.
Any tenderness? Nope. Any tenderness? Nope. Any tenderness? Nope. And any tenderness?
No.
Nope. Okay. Now I'll just be checking for tactile effeminance on your back. So say 99 when I tell you to.
Okay.
Okay? Okay. Say it now.
99,
Again?
99,
Again?
99, 99.
Okay, so no tenderness is shown, and tactile effeminance shows normal vibrations throughout.
Okay, thank you.
No problem. Okay, and now I'll just be percussing your back.
Okay.
That's okay? Okay. Okay. And now I'll just be percussing your anterior chest.
Okay.
That's okay if I touch you?
Mm-hmm.
Okay, so normal resonance for the posterior and anterior chest.
Okay.
Okay, so now I'm going to be auscultating your anterior chest. Just breathe with your mouth open.
Okay.
Okay, so lungs are cleared bilaterally for the anterior chest, and the rails, bronchi are wheezing.
Okay, thank you.
No problem. Okay, and now I'll just be auscultating the back. If you can just cross your arms and breathe with an open mouth for me.
Okay.
Okay, so lungs are cleared bilaterally for the posterior, and no rails, bronchi, or wheezing is shown.
Okay, thank you.
No problem. Okay, and now I'll just be checking for chest expansion.
Okay.
So when I tell you to, just breathe in. So breathe in for me. Okay, so chest expands symmetrically. Now I'll just be doing the Abdomen test.
Okay.
So when I tell you to, say E for me. Say E.
E.
Okay, so your Abdomen test is negative. Okay, so patient is supine with knees bent. I'm just going to be inspecting your abdomen. So no masses, no lesions, no scars, no venous abnormalities. Aortic pulsations not visible, and no bulging flanks indicating ascites. Okay, now I'll just be auscultating your abdomen.
Okay.
The right upper quadrant with the diaphragm, right lower quadrant with the diaphragm, left upper quadrant with the diaphragm, and left lower quadrant with the diaphragm. Okay, now I'm just going to be checking for bruits. I'm going to ask you to inhale. When you exhale, you might feel a little bit of pressure. Switching to the bell. Inhale, and then exhale. Okay. Just going to be doing the left renal artery. And right renal artery. Okay, so all four quadrants have normal active bowel sounds, and no bruits are present in the aortic and the renal arteries.
Okay, thank you.
Okay, so now I'll just be percussing your abdomen. It's okay if I touch you? Okay, so the left upper quadrant. Good. Left lower quadrant. Right upper quadrant. Right lower quadrant. Okay, abdomen is tympanic throughout. Now I'll just be measuring your liver span.
Okay.
Okay, if you could just put your finger right here, this marks the superior border of the liver. Okay, if you could just use your other finger, grab the ruler. Okay, liver span is 11 centimeters. Okay, now I'll just be palpating your costovertebral angles to see any tenderness. On the right side. Any tenderness?
No.
On the left side. Any tenderness?
No.
Okay, so no tenderness with the costovertebral angles. Now I'm just going to have you roll over towards me. I'm just going to percuss your spleen. Okay, and splenomegaly is not shown.
Okay.
Okay, and now I'll just be palpating the abdomen, starting with superficial and then going into deep.
Okay.
So palpating superficial, the left upper quadrant. Any tenderness?
Mm-mm.
And then deep. Any tenderness?
No.
The right lower quadrant, superficial. Any tenderness?
No.
And then deep. Any tenderness?
No.
And the left upper quadrant, superficial. Any tenderness?
No.
And then deep. Any tenderness?
No.
The left lower quadrant, superficial. Any tenderness?
Mm-mm.
And then deep. Any tenderness?
No.
Okay. So all four quadrants are non-tender and soft. Okay. And now I'll just be palpating your liver.
Okay.
I'm just going to touch right over here.
Okay.
And then when I tell you to inhale, just inhale for me.
Okay.
So inhale. And exhale. Okay, so liver is smooth and less than 1 centimeter below the right costal margin.
Okay.
Okay. Okay, now I'm just going to be palpating the liver.
Okay.
So just inhale for me, and then exhale. Okay, so liver is smooth and less than 1 centimeter below the right costal margin.
Okay.
Okay, now I'll just be palpating your spleen.
Okay.
So if you can just roll over to me.
Okay.
Okay. Okay, so spleen is not palpable, which is normal. That means your spleen is not enlarged.
Okay.
Okay, now I'll just be checking for ascites. I'll be doing the fluid wave test. If you can just keep your hand midline for me.
Okay.
Okay. Okay, fluid wave test is negative.
Okay, thank you.
No problem. Okay, I'm gonna go ahead and check your gallbladder. We're gonna do the Murphy's test.
Okay.
I'm just gonna palpate and then inhale for me. Any tenderness?
No.
Nope. Okay, so Murphy's sign is negative. I'm just gonna go ahead and check for McBurney's point, which is gonna be for your appendix.
Okay.
So it's gonna be from your hip bone to the 1/3 of your belly button. Okay. Any tenderness?
No.
Nope. Okay. McBurney sign is negative.
Okay, thank you.
No problem. Okay, so after the abdomen exam, we usually recommend our patients to have a rectal exam. Is that something you would be open to?
Sure.
Okay, perfect. Okay, I'm gonna go ahead and start the cardiac exam, if that's okay with you. So the patient is supine at 30 degrees. I'm inspecting. No heaves, no lifts, no scars, no abnormal pulsations. Okay, I'm gonna go ahead and measure your JVP. Okay, if you can just turn your head to the left for me. So to put this ruler on your sternal angle. I'm looking for the topmost flickering of the JVP pulsation. Okay. I see it. I'm gonna measure it. Okay, it's 3 centimeters, which is normal.
Okay, thank you.
No problem. Okay, I'm gonna go ahead and auscultate and palpate your carotid arteries.
Okay.
Going to auscultate with the bell. On the right carotid artery. Good. Okay, on the left carotid artery. Good. Okay, no bruise are present on the carotid artery. Now I'm just going to palpate the carotid artery, starting with the left and the right carotid artery. Okay. Okay, carotid pulsations are 2+, symmetric bilaterally with good upstroke, and no thrills are present.
Okay, thank you.
No problem. Okay, I'm gonna go ahead and auscultate on the 6 valvular areas.
Okay.
First with the diaphragm, then working my way up, back up with the bell.
Okay.
Okay. Listening to the right aortic valve on the second intercostal. Left pulmonic valve on the second intercostal space. I'm going to be listening at the tricuspid at the 3rd, 4th, and 5th intercostal space. And I'll be listening to the 5th intercostal space on the midclavicular line, which is the mitral valve. Okay, now I'm going to work my way up with the bell. Okay, listening for the same areas, so mitral valve at the midclavicular 5th intercostal line. Okay, feeling the tricuspid, 3rd, 4th, and 5th, starting with the 5th, 4th, 3rd intercostal space. Feeling hearing pulmonic valve on the 2nd intercostal space on the left. 2nd intercostal space on the right, aortic valve. Okay, so regular rate and rhythm. I heard the S1 and S2 sounds, and no rubs, gallops, or murmurs in the aortic, pulmonic, tricuspid, 3rd, 4th, and 5th intercostal, and mitral valve.
Okay, thank you.
No problem. Now I'm going to palpate for the PMI, which is the point of maximal impulse.
Okay.
Any tenderness?
No.
Okay, so PMI is palpable in the midclavicular line on the 5th intercostal space.
Okay.